So today I'll be explaining about MTP, that is medical termination of pregnancy. MTP is termination of pregnancy before full terms. It is not prevention of pregnancy, but it is termination of pregnancy. 45 to 50 million MTPs are performed every year, indicating it has a significant role in reducing the population. MTP is safe till 12 weeks of pregnancy or first trimester. MTP was legalized in 1971 in India, and an act was passed called as MTP Act. According to this act, MTPs can be performed only under certain conditions, and those conditions are casual unprotected sex, crime related issues, severe genetic disease of fetus, contraception failure, if continuation of pregnancy is riskier for mother or fetus. So most of the common method of abortion or MTP is vacuum aspiration. Next topic is sexually transmitted diseases. As the name indicates, these diseases will pass from an infected individual to normal individual primarily through sexual contact. They are also called venereal disease or reproductive tract infections. Bacterial STDs. First is gonorrhea. It is caused by Neisseria gonorrhea. There is abnormal yellowish discharge is a characteristic features of this disease, and the mother who suffers with gonorrhea, after the childbirth, the child is supposed to get the eye infection, which however can be cured by use of specific eye drops. Syphilis, caused by Treponema pallidum, it is characterized by painless ulcers. It is called as chancre. Chlamydiasis, caused by Chlamydia trachomatis. It is a silent STD because those who suffer with only chlamydiasis, they are supposed to have very mild unnoticed symptoms. But many a times what happens, chlamydiasis as well as gonorrhea, both of them infect. If a person is infected with gonorrhea, he also gets infection with chlamydiasis in many of the cases. So there is co-infection in many of the cases. So bacterial STDs can be cured by antibiotics. So bacterial STDs can be cured by chemicals called antibiotics. These are the chemicals that can kill the bacteria, like azithromycin, erythromycin, penicillin, etc. Now the next STD, viral STD. That is first one, of course, AIDS caused by HIV virus, hepatitis B caused by hepatitis B virus, genital herpes caused by herpes simplex virus, and genital warts caused by human papilloma virus. So what again you should know is, most of the viral STDs are not easily curable. That means AIDS is not curable. Hepatitis B is curable only when taken in advance vaccination, but if vaccination is not taken, again it is incurable. Genital herpes, disease progress can be stopped, but the pathogen cannot be removed from the body. Whereas genital warts, once the warts has been developed, warts can be removed by cryosurgery. So cure for viral STDs are more difficult more difficult compared to bacterial and protozoan STD. Now protozoan STD is trichomoniasis, caused by Trichomonas vaginalis. This is a protozoan STD. This is characterized by abnormal discharge by fetid odor, but however this can also be cured. How do STD transmit from infected individual to normal individual? That itself is explained by mode of transmission. The common and the primary mode is sexual contact. Other mode is if unsterilized needles are used and or you can tell if disposable needles, syringe needles are not used, then there is a possibility common to spread. If the surgical instruments are not sterilized, if unsterilized surgical instruments are used, and that time also it can pass from affected individual to normal individual. Then it can, most of them can transmit from mother to fetus, usually viral disease. General symptom of STDs. It is a general symptom. These symptoms do not belong to one particular STD. First one is scratching, feeling like itching, and there is nothing but itching here. Abnormal fluid discharge, as in trichomoniasis or as in gonorrhea. Swelling, slight pain. So these are general symptoms of STD. Complications. If STDs are not treated, then it leads to complications. What are the different complications due to lack of treatment of STDs? Pelvic inflammatory diseases. You know that reproductive system is located in pelvic region, and if STD is untreated, it can spread around in the wider region, in the pelvic region. So that may result in pelvic inflammatory disease. Untreated STDs may lead to spontaneous abortions, death, then also it can lead to stillbirth, that is death of fetus in the womb itself. It can also lead to ectopic pregnancy. Now what is ectopic pregnancy is normally implantation of blastocyst occur in uterus. Now if blastocyst will implant in the site other than uterus, in an abnormal site, then pregnancy starts in an abnormal site other than the uterus, then it is called as ectopic pregnancy. It is because of a condition called endometriosis. What is endometriosis is endometrium grows on the starts spreading and grows in other sites like fallopian tube or over the ovary or other regions. Then there is a chance that the implantation can occur other than uterus. So therefore such type of pregnancy is called ectopic pregnancy. Majority of the ectopic pregnancy are localized in fallopian tube. STDs can also lead to infertility and also lead to cancers like cervical cancer, or you can tell ovarian cancer, like that. It leads to cancer. The age group that is more vulnerable for STD is 15 to 24 years. How it can be prevented? Avoid multiple sex partners, use of contraceptives like condoms. When in doubt, visit doctor.